Welcome to the Checkup. I'm Modern Healthcare's reporting fellow Lauren Berryman. Thanks for tuning in. This year alone, 22,000 lives have been taken by gunfire, and 19,000 others have been injured in the US. Some of these people were victims of the 320 mass shootings this year, and others were victims of everyday gun violence. Hospitals and healthcare workers are not immune to this crisis. Violence has targeted hospitals and staff at the same time that clinicians are having to respond to victims. Joining us to discuss his leadership and perspective as an emergency room physician is Dr. Kevin Minnis. Dr. Minnis was a contracted emergency physician at a Las Vegas hospital the night a gunman fired upon hundreds of people on the Las Vegas Strip in 2017. Dr. Minnis is now an emergency physician in Dallas and founder of Minnis Resuscitation. He also guest speaks about treating gun violence victims and preparing for mass casualty incidents. He's talking to us today as an expert and not as a representative of his employer. Welcome to the Checkup, Dr. Minnis.
Thank you for having me, Lauren.
So you worked in the emergency room the night of the Las Vegas shooting, and you told me that the shooting started around 10:04 p.m., and you got your first patients at 10:24. What was it like working that night?
As ER doctors, we go through this cycle during a resuscitation. There's this fear that you go through because you're unsure if you're going to save someone. And then as they start to turn the corner and you save them, then it turns to acceleration. But that night, because there were hundreds of these victims, that cycle just perpetuated itself over and over again. And added to that was this fear that there just was not enough time to save them all. And so it's hard for me to put all into the short amount of time what it's like, but that's kind of the cycle that occurred, nonstop for a couple of hours.
Sure, and hospitals have these plans to respond to mass casualty incidents in place, but you never know how effective a plan is unless it's put to the test. So what happens when a plan hits reality? Like, how did you execute a plan so quickly and adjust for what needed to be done?
Well, the great philosopher Mike Tyson once said that everyone has a plan until they get punched in the mouth. And so, the truth was, I had this idea of I learned about mass casualties when I was in Detroit as a ER resident when the Super Bowl was coming to Detroit. I learned how we're supposed to run mass casualties, and over the years of just managing patients and learning efficiency and flow in a busy emergency department, I realized that those ideas don't really handle even just a busy day in a hospital.
Mm-hmm.
The ideas of tagging, the idea that we use salt and start triage, which are basically used in the field, not supposed to be used at the hospital. And so over the years, between that and working with the SWAT team, I started to get an insight into what happens when these gunmen, or what they do and what they could potentially do. And that really opened my eyes to maybe I need to prepare for something like this. And so I had ideas, I ran them through my head, talked to other people for years. I just sort of kept it quiet, say things to people, because you talk about this stuff to the wrong people and they think you're crazy. So, the way that I prepared for something like this was, I mentally rehearsed it. And that was really what allowed the ideas to just pop into my head when, that time arose.
Right. And so you say you had these ideas in your head, you were pre-planning. So would you say that the standard plan would have worked the night of the Las Vegas shooting?
There are a number of hospitals that have employed that plan, and it works. When you talk about a mass casualty, that's 3, 4, 5, maybe even 10 people, right? But when you start to talk about the numbers that some of these evil lunatics are out there, and they're, just the other day, right on July 4th,
Mm-hmm.
that shooting with a couple dozen people, change that to now a couple hundred people or a couple thousand people, and now you're looking at the wheels just start falling off, right? So you really have to have an idea or a plan that can scale or handle something big. Because if you can handle something large, then the small stuff is really, really easy. But if you have a plan that works most of the time, because you've never been tested, when you are tested, what you'll find is the wheels will just fall off, and people will die as a result.
Mm. And so, thinking back to that night, how many victims came through your all's door? How many died, and then how many were saved?
Um, I was recently told by a friend that there was some independent reviews of the security footage, and the independent reviewers couldn't even agree on how many patients came through the door. So the number is somewhere between 280 and 320 is what I was told.
Mhm.
Um, but that night, yeah, despite that, the team ended up coming together and working to save everybody who could have been saved that night. We had 10 people who came in who were dead on arrival. We had 4 that were resuscitated by us and handed over to trauma surgery, but they deemed them unsalvageable. And so they ended up expiring. And then 1 died in the operating room, and 1 died or was found to be brain dead later. So, out of that many people, despite having just, a few staff working that night, we were able to, manage to save everybody that night.
Right. And so, what was unique about how you all responded to the Las Vegas shooting?
Well, like I alluded to earlier, the triage systems that are out there for handling mass casualties are intended for the pre-hospital environment. They aren't actually intended for in the hospital itself. So the triage sorts the victims so that you can figure out who you need to work on next. And so this idea of red, yellow, green is what typically happens out in the field. But really, when you look at it, it's the red victims are the ones who are going to die. And what we ended up doing with our triage is we separated it out so that the reds were graded into red, orange, and yellow. And by doing that, we were able to figure out who was going to survive,
Mhm.
or who we could save in that first 10, 15 minutes. The next group who was dying, we could save them and then move on to that last group. And even with the minimal staff that we had initially, we were able to, perform all those resuscitations and save all those victims. So um,
Mhm.
that triage is really the key, because everything else is exactly what you would normally do, which is ATLS. But in order to pick out who need to be worked on first, triage is the most important component.
Mhm. Right, and I mean, sounds like it proved incredibly effective, and you all are credited with saving hundreds of lives. So, did you or your hospital hear from counterparts after the shooting to pick at your brain about how well your emergency response worked, or what didn't go as expected? What did they have to say?
I mean, I heard stuff from other, it was word of mouth from somebody else who heard it from somebody else. But I think when you're in a situation like this, um, there is a somberness to what you saw. And, it's hard to discuss or even think about this type of material. And partly the only reason why I continue to do it is because I was told that this material can save lives, and
Mhm.
sharing it is really why I continue to do that. Because if somebody can get saved by just the experiences that we had to deal with, then it's worth having to rehash those memories.
Sure. And before Las Vegas, you mentioned earlier that you had experienced treating gunshot victims during your residency in Detroit. And you mentioned previously that a shooting broke out between 2 people inside the hospital there, and that was the first time you had encountered an active shooter. What was it like, and what did that experience teach you about what works and what doesn't work?
Yeah, that was a um, a depressed family member being brought in by another family member, and that family member shot um, their sibling, and then was then shot by security. And so, immediately we had two gunshot victims,
Mm.
and we had more than enough doctors to work that day, since it was lecture day and we were all coming up from lecture. But I remember walking into the recess bay and just realizing that this protective bubble that I thought I lived in inside the ER, where no violence happens and it doesn't really ever enter our doors, was a myth. And that, the only way that I could ever be safe was to figure out a way to handle um, a active shooter, because at that time I asked myself honestly, did I have an idea of where I was going to go and what I was going to do if there was an active shooter? And the truth was, I had no answer to that.
Yeah.
So after that, I would secretly come up with, I would walk the ER, figure out where all the exits are and know where all the ins and outs of all the rooms are, and then just know what I would potentially have to do if something like that happened, and it ended up paying off, in the future.
Sure. And I mean, no one ever thinks it's going to be them until something so scary happens. But that pre-planning that you did after that one incident proved effective later on when you were in another active shooter situation in Las Vegas. Um, and hospitals have active shooter plans in place that, in a nutshell, tell you to run, hide, and fight. So, having worked at hospitals during active shooter situations, do you think that plan is effective?
I do. I mean, it's what other options do you have, right?
Mhm.
You run, hide, and fight, but the truth is, you also have patients who are there, and there's, as healthcare providers, we have an attachment to our patients,
Mhm.
even though we just met them, and so you can run, hide, and fight to save yourself, but they're uh, you leave your patients there and you worry what can potentially happen. So and I don't promote this. I don't say that you need to shield your patients and figure out a way to protect them. But the to think about how you can survive that, or how you can maneuver some of them out too, is an additional worry that we end up having to, many of us end up thinking doing. So run, fight, run, hide, and fight is the typical active shooter
Mhm.
protocol, but our patients end up adding an additional level to that.
Right. And so, since that active shooter situation in Detroit, you said you always make sure that you have your own active shooter plan in place the day you start working somewhere new. So, how did this help you when you moved to Las Vegas and started working in the emergency department there?
Well, what it helped me do was I realized and knew where all the exits were, and then I knew that if bullets started flying in the emergency department, which beds were on the other sides of the walls, right? I mean, in the movies, oftentimes the bullets stop when it hits a wall, but most walls are just made of drywall, which does not stop bullets.
Right.
And so, luckily, I wasn't in an active shooter. This was a gunman who walked into the ER, didn't actually start shooting at everybody yet, but threatened the nurse that he was about to do so. And so, luckily, it didn't end up being an active shooter. Otherwise, my plan probably wouldn't have worked.
Mm.
Wouldn't have saved anybody, because it would have happened so quickly that none of it would have fallen into place. But because this ended up being um, a gunfight between the police and the gunmen, what we were able to do was move all of the patients who were in the line of fire out of the way. And so, in the end, it was really just the gunman who lost his life that day.
Mm. So scary. And so, lastly, what do you think hospitals can do better regarding emergency preparedness? And what role do you think hospitals and the healthcare system have to reduce gun violence?
Well, I think the best thing that can be done is to just be prepared. There's Oftentimes there are plans that are out there that um, are based on statistical analysis. And if you want to use statistics as your litmus test for how you want to do this, then your result will probably be an average, because that's what statistics are going to get you. Really, these lunatics who are out there who are um, uh, formulating these plans to harm as many people as possible, they're learning from others, and looking at history and trying to plan accordingly to what these gunmen are doing will help you prepare for what's ahead. Because unfortunately, history shows that it's only getting worse, and it's not getting worse because of the gun itself. It's getting worse because the information that is available to people about how they can hurt others, and what happened in the last shooting and what sounds like it worked better, ends up going into the next shooting, like this past shooting in Illinois.
Mhm.
You know, I don't know if it had anything to do with it, but he took an elevated platform to shoot down at everyone, and so a lot of
In
the
Las Vegas.
yeah, a lot of the coverage that happens in the news, it gets you it gets coverage. It feeds the public's interest, but at the same time, you have to think about what you're also doing, which is the double-edged sword, right? You're teaching somebody how they can further harm others. So
Mm.
I think that is something that needs to be talked about and thought about. And as far as a healthcare provider, I mean, I'm at the receiving end. I think the best that we can do in the hospital is to be prepared to handle it all. No matter what comes our way, no matter what time of day. I think we have to be prepared to handle and save everybody. Not an average response, but the best response possible, because that's what the public expects of us, right? To be the best and to save everybody, no matter what. And so, I have articles that I've written on this stuff. They're all free. They're on epmonthly.com under my name. And there's an article that just was released a couple of days ago regarding multiple mass casualty incidences, which are um, these incidents where these lunatics are actually using multiple devices and multiple means to try to harm and kill as many people as possible. And so, hopefully none of that ever comes to fruition, but unfortunately, history is telling us that it is. And so, just being prepared as much as possible will help.
Sure. Well, thank you so much for joining me and sharing your insight and your own personal experiences, Dr. Menace. Really appreciate it.
Thank you, Lauren, for having me.
And thank you all for watching the checkup.